Hello, welcome to the mini episode with Dr. G. And today we have with ourselves one of our very good friend, and he has been our patient for last few months and has referred so many other people just after the difference he noticed in his life. So welcome, Mr. Robert. So tell us about you've been our patients for hormone replacement as well as for the weight loss.
Yes.
How was your experience, given that you were I would say that you're still a bodybuilder, but you had been to that competitive stage, and what effect you have seen on your body, and what advice you can give it to the other athletes and bodybuilders?
Well, I've been involved in athletics, in martial arts, in powerlifting and weightlifting for, close to 40 years. It's been a long time. And over the years, I've put a lot of stress on my body, going up and down in weight. I started off, if you can believe it, at 119 pounds, and I wound up as high as 250 pounds. So that's a huge difference.
I'm still stuck somewhere in 160s.
But that's a lot of wear and tear in your body, and as we get older, it just makes it more difficult to really do basic things without feeling really good.
Yes.
So I've known Dr. G for several years now. We actually met at the gym where I was training, and of course I was a lot bigger then. And if anyone knows anything about Dr. G, he's competed and he's done really well too. But I reached out to him, what was it, last year?
Yes.
Middle of last year, when I realized he opened a clinic, and I said, you know what, I need a new doctor because I need my test levels and my hormones levels and everything else checked out for my health benefit. And ever since then, it's been absolutely amazing. He's the first doctor that's actually taken the time to really assess all the issues that I was having to find out what the root causes of all those problems were, and actually came up with a treatment to help me get back to where I should be. And it's been 3 or 4 months now, and today I'm here for my lab work, and I've noticed a huge difference in the way I feel, my sleep patterns, just overall health in general. Last month we did the pellet injection for my testosterone levels because they're obviously really low, and I feel amazing. I mean, it's great. Everything it's like a night and day change ever since I'm the Dr. G. So
it's really very important, and that's what we focus on, finding the root cause of your problems. Because many times you go and trust your physicians, and they just basically treating the symptoms. Like if you have insomnia, if you have this, they are not looking for what's causing the real issue. And that's very important because that's only when you can treat the problem from the root.
Yeah, I agree. And I didn't realize that until, Dr. G had sat down with me, and, he's spent quite a bit of time, consulting with me, giving me this information. But in the past, I would say, this was giving me problems, or that was giving me problems. And all they would do is just prescribe something. They wouldn't try to find out what was causing the problem.
When Robert came, I remember you were on a bunch of medication for high blood pressure and this and that. So are you still taking all the medications?
No, as a matter of fact, it was the simplest thing. I never had a blood dump in years and years of training, and that's all I really needed. And ever since then, I don't need blood pressure medicine now. My sleep pattern is completely changed, and it was all because of my blood. I didn't realize
and people don't realize it that how one thing can affect another thing. And it's very important for you to seek a help with a physician who understands the overall approach, the functional approach to the medicine, and finding the root cause of the problem and treating that instead of just prescribing one medication after another, which a lot of times has other side effects, and it becomes like a vicious circle. And because the people, they don't know, and they trust their physicians, and now because of the insurance and everything, nobody wants to give that much time, and they just write a prescription on the next patient. And that is a bad, I would say that a culture which is going in healthcare. By giving time, listening to, and combining multiple modalities of treatments, which can actually help, like stress reductions. We always do the breathing exercise, yoga, meditation. They all can improve because life is stressful as such.
Oh, yeah, absolutely. And now that I'm close to 55, life is obviously a lot more difficult, physical-wise, especially with the background of powerlifting and whatnot. It takes a toll on your body. But I'm very grateful that Dr. G is in my corner, and that he's a good friend of mine, and he's made a huge difference in the way I feel.
Thank you, Robert, and thanks for coming today.
No, you're welcome.